Good evening, everyone, and a warm welcome to all those joining us today for this important awareness session Understanding the Silent Threat Liver Cancer Awareness. This session is part of Voice of Healthcare's ongoing commitment to creating conversations that matter, bridging medical knowledge with public awareness. We are proud to collaborate with Eisai Pharmaceuticals India for today's talk. Our focus today, liver disease, from silent symptoms to stronger survivorship, is especially crucial. The liver, often called the body's silent powerhouse, performs over 500 vital functions, from detoxifying our systems to aiding digestion and metabolism. Yet, when it starts to fail or when cancer develops, it often does so quietly. Symptoms remain subtle until the disease has progressed, making awareness and early action absolutely vital. And to help us better understand this silent yet serious threat, we are honored to have with us Dr. Mohammed Zehran S, Senior Consultant in Medical Oncology at Apollo Cancer Center, Chennai. Dr. Zehran brings years of experience in oncology and a deep passion for improving cancer outcomes through awareness, prevention, and compassionate care. Thank you, Dr. Zehran, for joining us today. Let's begin
Thank you,
our
Mayank.
conversation. Let's begin our conversation by understanding the basics. So, Dr. Zehran, to begin with, what exactly is the liver cancer and what are the common early signs that people should look out for?
Sure. Firstly, thank you, Mayank, for inviting me this evening. I just want to check that you can hear and see me clearly.
Yes.
Sure. So let's start. What is liver cancer? Like any cancer, liver cancer is one where abnormal cells in the liver grow uncontrollably, forming a tumor. And when these tumors develop into more aggressive types where they can grow and spread, they are called cancers. So if it develops in the liver, it's called a liver cancer. If it develops in the lung or the colon, it is called the lung or the colon cancer. At this point, I just want to quickly help you understand that liver cancer is broadly of two types. What we're going to talk about today is what we call the primary liver cancer or hepatocellular carcinoma, a cancer that actually starts in the liver. There are also secondary liver cancers which start in other organs and spread to the liver. They are secondary liver cancers or metastases to the liver. For the purpose of time, we'll probably stick to the primary liver cancers or hepatocellular cancers today.
Okay. So, sir, who is at the higher risk of developing liver cancer and what are the main risk factors clinicians and the public should be aware of?
Sure, sure. So I'll just briefly tell you about what the public has to firstly look out for in terms of symptoms. The symptoms of liver cancer can be quite subtle, quite vague, not necessarily symptoms that will ring alarm bells. For example, feeling a bit tired and there's no explanation for that, loss of appetite, mild discomfort in the tummy. In some cases, people can present with jaundice, which is yellowing of the eyes, yellowing of the skin, dark urine, etc. So these are some symptoms that one would associate with liver cancers. That said, these symptoms can also happen in non-liver cancers, for example, hepatitis infections or any other inflammation of the liver. So these symptoms don't always mean that one has a liver cancer, but they certainly warrant certain investigations to be done to make sure we rule out liver cancers. When it comes to who is at risk of developing liver cancer and what are the main risk factors, um, one is certainly alcohol and excessive alcohol consumption, but that's not the only risk factor for developing liver cancer. Chronic infections of the liver, like a hepatitis B infection or hepatitis C infection, which are viral infections, chronic inflammation of the liver, cirrhosis, which is nothing but scarring of the liver, fatty liver is also one of the reasons. The risk factors for developing these problems in the first place, as I said, one could be alcohol use, obesity is another one, uncontrolled diabetes, an exposure to certain toxins in food, in contaminated food, that can also cause one to develop a liver cancer.
Okay. So, sir, as a medical oncologist, could you describe the current prevalence and trends of liver cancer in India? Are certain region, age groups, or populations more effective?
Sure. So, although the data is not as robust in India compared to the Western world, we know that there's approximately 30,000 people or so in India who develop liver cancer every year. We have seen a slight prevalence in states in the northeast of India, in the coastal regions, etc. And we've seen that men are disproportionately affected more than women. One reason why you would see a slight high prevalence in the north eastern states in India are possibly because one, hepatitis seems to be a bit more common in these areas. Another reason could be the humid temperatures and the way rice, etc., are stored, which perhaps could lead to a certain toxin called the aflatoxin from the aspergillus fungi, which tends to grow in these products, which can increase the risk of one developing liver cancers. In terms of the age groups, the fourth to the seventh decade, i.e., 40 to 70-year-olds, are generally the kind of population that would develop this kind of cancer. That said, we do see patients who are much younger than 40 and much older than 70 who also come to us with liver cancers, unfortunately.
Okay. So, sir, I think lifestyle plays a huge role in liver health. How do habits like diet, alcohol intake, or obesity influence the risk of liver cancer?
Sure. So in liver cancers, there are certain um, um, modifiable risk factors and certain non-modifiable risk factors. For example, if one has developed a liver cancer because of a family history or a genetic issue, uh, there's not much we can do apart from picking it up early. But there are a lot of modifiable risk factors. For example, excessive alcohol consumption, um, which can lead to cirrhosis over time. And cirrhosis is a major risk factor for developing liver cancer. A diet which is high in processed food, sugars, etc., can lead to obesity, which in turn can lead to a fatty liver, which is nothing but excessive fat deposition in the liver, reducing the ability of the liver to function well and thereby increasing the risk of developing liver cancers. So these are modifiable risk factors which one can do something about to try and minimize the risk of these things from happening. For example, cutting down on alcohol or stopping alcohol consumption, which is probably safer, reducing food where there's a lot of processed items in it, regular exercise, good control of diabetes, vaccination against hepatitis B and C virus, which are also important causes for eventually developing liver cancer, etc.
Okay. So, why is regular screening and early diagnosis is critical when it comes to liver cancer?
So it's quite simple, Mac. The earlier we pick up a certain cancer, the more successful we are at treating it and possibly curing it as well. And liver cancer is no exception. So, where there are certain high risk individuals, for example, those with chronic hepatitis B virus infections, chronic hepatitis C infections, those suffering from fatty liver, those with cirrhosis, we know that they carry a certain risk of developing liver cancer. Likewise, people with a family history who have some kind of genetic predisposition to it, these are kind the people where you want to sort of start testing early and actively look out for this cancer, because I said to you earlier that the symptoms can be quite subtle, quite vague, and one doesn't necessarily need to think that they have a cancer because they have those symptoms. So what we would do for these high risk individuals is to regularly check them, to do some blood tests to look out for any clues if they're developing a liver cancer. One of those tests is a chemical in the blood called the AFP, or the alpha fetoprotein, which in certain liver cancers can be secreted. And if it is on the higher side, there is a suspicion that they could be developing a liver cancer. There's another test called the PIVKA2, which we would also do to try and seek out these patients who might be developing a liver cancer and try and pick them up early. We do also combine with some basic scans like the ultrasound scan, which can pick up abnormalities in the liver. And there are some higher end testings also, for example, a CT scan or an MRI scan, which might give you more information about the liver health and if one is in the process of developing a liver cancer or has developed a liver cancer. So, to summarize, the earlier we pick up, uh, usually it's at an earlier stage, and the treatments can be a lot more successful when you treat an early cancer.
Okay. So, sir, as you have mentioned treatment, what are some of the latest advances in liver cancer management today?
Sure. So when you talk about treatment of liver cancer, you broadly put them into three categories. The first one is the surgical treatment of liver cancer. The second one is what we call liver directed therapy. So you want to do something directly to that cancer in the liver. A third one is with medication, injections, and so on. So for the first one, there's been a lot of development in terms of surgical procedures. Transplant surgeries have become a lot better, a lot successful. Surgery has incorporated robotic surgery into it, which has also improved their outcomes greatly. When it comes to the middle portion, which is the liver directed therapy, things like TACE, for example, which is trans-arterial chemoembolization or trans-arterial radioembolization, or certain newer radiation techniques like the cyberknife radiotherapy or the proton radiotherapy, have given us the ability to increase the dosage to these cancers and minimize the outcomes of these cancers.
Okay, sir. So, given the potential side effects of radiation or therapies, what are the common and challenging side effects you manage for liver cancer patients, and what best supportive care strategies to manage those? Hi guys, I think Dr. Zehran has some connectivity issue. He's joining back with us.
Hello, can you hear me now?
Oh, yes, you're audible.
Yeah. Sorry,
Yes.
I think I dropped my connection there. Can you
No
hear me,
issues.
Mayank?
Yes, sir.
Yeah.
I'm audible.
Yeah, so we were just talking about treatments. The last form
Yes.
of treatment is with a combination of immunotherapy and targeted therapy for patients where you want to try and keep this cancer under control and prolong their life. So these are the advancements in treatments for liver cancers.
Okay. So, sir, given the potential side effects of radiation or therapies, what are the most common and challenging side effects you manage for liver cancer patients, and what's the best supportive care strategies to manage those?
Sure. So one is the management of the physical side effects that come with it, the surgical related side effects or the medication related side effects, and you would manage them accordingly. For example, pain or nausea, vomiting, abnormalities in liver function. You would do all of that with medication, and there are a lot of good medications we can use to do that. But we should also touch upon the fact that coping with liver cancer can be quite emotionally challenging, both for the person who's going through that treatment and for their loved ones, their friends and families around them. So we would normally work very closely with our onco psychology team or onco psychiatry team to provide the right kind of mental support they need, because mental health is as important as the other treatments that get given in this scenario. There are certain support groups in certain hospitals which are also extremely beneficial to help these patients through their cancer treatment journey. These treatments, you must understand, can be quite expensive. There are helpful NGOs around who can provide resources, both from a social point of view and financial point of view, to help patients navigate through this, to help with their treatment, to manage stress, to improve treatment adherence, etc.
So, sir, there are often a lot of misinformation about liver cancer. Could you help us clarify few common myths you often came across? So, the first myth is there is no way to prevent liver cancer.
Okay, so I hear that too. Um, Basically, we can try and work on the modifiable risk factors to try and see if we can minimize the risk of developing a liver cancer or trying to pick up a liver cancer early. So, where patients or where one is consuming a lot of alcohol, it would be helpful to cut down or stop alcohol, because that is certainly a risk factor. Where one is at risk of hepatitis B virus infection or C virus infections, there are very good vaccinations against hepatitis B and C virus infections, which can reduce the risk of one developing this virus, which eventually can lead to cirrhosis and liver cancer. Where one is not undertaking a healthy lifestyle, exercise, looking at their diet, reducing obesity, etc., can play a vital role in minimizing the risk. So it would be a myth where one says nothing can be done to reduce the risk of liver cancer. Just to add in there,
Uh,
Mayank, also
yes, please. I think there is again some issue with Dr. Zehran's network.
hello, can you hear me now, Mayank?
Yeah, so you are back.
Sorry, I got dropped again over there. Another thing I wanted to mention was where people say that nothing can be done once the diagnosis of liver cancer can be made. As I mentioned earlier, a lot can be done. If it is picked up early, then treatments can be designed to optimize the chances of a cure. Where it is picked up at an advanced stage, we can still do something to try and keep it under control, to control the symptoms and to prolong one's life, even if they have advanced liver cancer, because of the uh, immense improvements in technology and treatments we've had in recent years.
So you have mentioned that the lifestyle. So another myth I have that we commonly listen is only heavy drinkers develop liver cancer.
Um, Not true. Yes, liver cancer can be caused by excessive alcohol, but that's not the only cause. As I said, obesity, uh, infections of the liver like hepatitis, fatty liver, uncontrolled diabetes, etc., or a family history, perhaps genetic links, can also lead to liver cancer. So it's not just heavy alcohol consumption, but a note for heavy drinkers is that their risk is perhaps higher than the general population who doesn't drink. So, it being a modifiable risk factor, it is perhaps something to think about to cut down significantly and stop if possible, because there's a lot of research saying that perhaps there may not be a safe limit for alcohol.
Okay. So before we close, Dr. Zehran, managing liver cancer is not just a medical journey, but an emotional one too. How can patients and their families access the right psychological and emotional support during the treatment and recovery?
Sure. So, cancer treatment is always delivered in teams. There's always a multidisciplinary team that work to try and optimize the treatments, to try and support the patient in a very holistic kind of a way. So, medical oncologist is one member of the team. There is a specialist nurse that works alongside, a counselor, a psychologist, an oncopsychiatrist, perhaps support staff who can look at the treatment in a very holistic way, who can support the patient in many ways other than just concentrating on the actual treatment, the physical treatment alone, which is where teamwork and a multidisciplinary approach goes a long, long way, where the team not only consists of all the members I've talked about, but also the family and friends to try and make sure that care is adequately delivered, which hopefully can lead to a successful treatment.
Thank you, Dr. Zehran, for sharing such valuable insights. Your expertise help us seize that liver cancer is not an untreatable or a hopeless disease. Early detection, preventive action, and compassionate support can make all the difference. Thank you
Thank you,
once
Mayank.
again. Thank you, sir. And to everyone watching, remember, only our liver rarely complains, but it deserves our care and attention. Thank you, sir, and thank you to all the viewers.
Thank you for inviting me, Mayank. Thank you.